Good afternoon, guys. Welcome to today's live stream for the week. So I want to thank you guys again for taking the time to tune into my live streams that I do every Wednesday. Like I mentioned before, I'm starting to do them in the afternoon at around 3 p.m. Central Standard Time. So in the future, when you want to tune in, just know that it'll be 3 p.m. Central Standard Time that I'm focusing on to see how gauge the engagement and what type of audience I'll gain versus, like I mentioned before, doing it in the morning and then doing it in the afternoon versus those two. So as far as things to get started, that's all I want to mention is I'm going to continue to do the 3 p.m. Central Standard Time for the live streams. I do want to mention actually another thing. For my YouTube page, I am going to continue posting live streams when they are finished there. But I also would encourage you to subscribe to my YouTube page because I'm also posting short form content there as well that you can view. Of course, I do a lot of fitness related content. So I'm posting both short form content as well as my previous live streams. I may in the future make some short videos to post outside, like just short videos on YouTube itself, not just the YouTube shorts, but outside of the live streams and everything. I may do some sort of videos like that. But most of the short form content, of course, is like under a minute. So you can definitely check those out and subscribe to my channel there. I do have the link on the group page. I can share it again pretty soon, or share it again sometime today, so you can check that out. So let's go ahead and get into today's topic. So today I'm going to discuss cardiorespiratory training. You guys probably know at least a little bit about cardio training. It's one of the most commonly known, training systems as far as it relates to fitness. But I'm going to dig a little bit deeper into what cardiorespiratory training is and, how you can integrate it properly into your workout routine. So cardiorespiratory training in itself, let's define exactly what that is. So cardiorespiratory training is the ability for the body, or cardio itself, defining cardio, is the ability for the body to supply oxygen-enriched blood to the circulatory and respiratory system during sustained physical activity to the skeletal muscles. So basically, cardio, in the name itself, is focusing on your cardiovascular system. Blood pumping, heart, things of that nature, supplying oxygen to your blood. It's all about sort of that energy is basically what defines cardio itself, the definition of it. Cardiorespiratory fitness itself is, well, I guess it's the same definition. The ability of the circulatory and respiratory systems to provide the body with oxygen during activity. So it's somewhat similar definition there. So we've got cardio, which is the ability of the body to supply oxygen-enriched blood to the circulatory and respiratory system. And then the fitness itself is the ability of the circulatory and respiratory system to provide the body with oxygen during activity itself. So that's basically the separate difference. The fitness aspect of it is the body is supplying that sort of oxygen during your specific activity you're doing with cardiorespiratory training, walking, running, anything of that sort. So that pretty much defines exactly what cardio is. So what I want to talk about here is, I've got a few missing points here, but they're pretty much self-explanatory, and we'll go through them. So the 5 components of fitness are cardio, the ability of the circulatory and respiratory system to provide the body with oxygen. This is one of the major components of fitness, as well as muscular strength. You've got muscular endurance, the ability to maintain force production for a long period of time, flexibility, normal extensibility of soft tissue that allows for full range of motion of a joint. Body composition as well. These are the 5 major components when it comes to fitness. Muscular strength is pretty much self-explanatory, and body composition sort of goes in line with muscular strength and muscular endurance themselves. It's just focusing on, sort of building muscle and building more of a physique. So that's sort of basically the 5 components of fitness, and cardio is one of the major sort of components that relates to that. So when we talk about cardio itself, what exactly are the benefits of cardio training? So structured exercise itself has been known to have various health benefits. So individuals can achieve numerous health-related benefits, focusing on both moderate to modest benefits and, of course, even greater benefits from vigorous intensity activity. So you're going to get overall enhanced health as well as weight loss. So another thing that helps when you're doing cardio training is research itself has confirmed that individuals who do cardiorespiratory fitness level, it reduces their morbidity and mortality rate. So, in other words, people in a poor cardiorespiratory fitness, of course, have a marked increase of risk of premature death. So you're lowering your mortality rate when you're, engaging in regular cardio activity. And also, it can be a preventative method when it comes to cardiovascular disease itself. And also, there's been research that does demonstrate that cardiorespiratory exercise and physical activity provide enhanced health benefits, longevity, as well as weight loss, like I mentioned before. So, individuals who are more active on a regular basis enhance their likelihood for maintaining these benefits, whereas somebody who is sedentary is going to experience rapid deteriorations in their overall health and well-being. So it's pretty much self-explanatory in itself. The more that you integrate active lifestyle into your daily life, the lower your risk of cardiovascular disease and the lower risk of mortality, of, I guess, longer lifespan, I guess I should say. Of course, we're all going to pass someday, but it's going to lower your mortality rate, where you'll live a little bit longer, where you have that possibility to live longer, as far as, having a structured exercise versus somebody who doesn't and who's in a sedentary lifestyle and who doesn't actively exercise. So what I want to talk about here is the components of cardio fitness training. So there's basically 3 key phases that I'm going to talk about with this. And that is known as the warm-up phase, the conditioning phase, and the cool-down phase. So these are the 3 major phases when it comes to cardiorespiratory training. And I'm going to go ahead and break these down. Let me just get my notes ready. So as far as for a cardiorespiratory warm-up, so a warm-up is generally described as preparing the body for physical activity. So it can be either general in nature or more specific to the activity. So general warm-ups themselves basically consist in specific movement that does not necessarily have any sort of connection to your actual exercise. So, sorry about that. So basically, what a warm-up is just, sort of getting the blood flowing, getting the body ready for more active workouts. That's basically what a warm-up is. And it don't necessarily have to be related to what you're specifically training. Cardio can be in itself, like say that you have sort of like a weightlifting routine that you do daily, you can integrate cardio as a warm up. You can, do like a warm up of cardio to start out and then go into weightlifting. So it doesn't have, the warm up phase doesn't have to necessarily, focus on the exercise itself or the sort of the target exercise you're doing that day. It's just to help to get the blood flowing and the body ready for that structured exercise. So, but you can have specific warm ups, of course, that do mimic your particular exercise. So, basically, let's kind of discuss here what the benefits are as it relates to warm ups. So, like I kind of mentioned, increasing your heart and respiratory rate is one of the major benefits, which is, getting your body prepared for the actual structured activity exercise. You have increased tissue temperature as well as increased physiological preparation for that bout of exercise. So, let's go back to the heart rate and respiratory rate. So, increased cardiorespiratory system capacity to perform that work, it helps with that capacity. And it helps increase the blood flow to the muscles as well as increasing the oxygen exchange capacity to the body. So with increased tissue temperature, you're going to have an increased rate of muscle contraction, increased metabolic rate, increased soft tissue extensibility. So it's going to help with your flexibility throughout your exercises. And it's also going to increase your mental readiness for that exercise. So, once you're in that mode and you're warming up, you're going to instantly be ready to get started and get going versus just running into or not running, but just going into an exercise without doing a warm-up phase. So it is a beneficial phase to go through. So let me sort of discuss some warm-up activities. So there can be self-myofascial techniques. The best way to describe these is basically like doing stretches with a foam roller. These can target certain specific muscles that you're, maybe have overactive or that are overactive or underactive that you want to stretch those muscles. So depending on what exercise or what split you're doing that day, it can be very helpful to focus on those specific muscles that you're trying to work out that day, doing the self-myofascial techniques, which is doing stretches with a foam roller. Static stretching, so just normal stretching itself. Again, when it comes to cardio training, you could do static stretches with calves, your hip flexors, and your lats. You could also do warm up, like I mentioned before, with cardiorespiratory exercise itself, which could be, maybe 5 to 10 minutes walking or running on the treadmill. That's a great way to start out. So those are some examples of warm up exercises starting in the warm up phase. So let's go ahead and go on to the conditioning phase. So basically what the conditioning phase is it is basically sort of the initial higher intensity training for the exercise itself. You're engaging in that cardio exercise. So it's the initial training, the workout exercise portion of your routine. So some of the benefits when it relates to cardiorespiratory exercise itself, it's going to help with your heart, strong and more efficient heart, your improved ability to pump that blood to the heart. You have that reduced risk of heart disease. It lowers your resting heart rate, lowers heart rate at any given level of work, improvement of lung ventilation. So those are some examples as it relates to the benefits of the structured conditioning phase of cardio exercise. So the cool down phase is a little bit opposite. Well, it's somewhat opposite of the warm up phase. So basically the cool down phase, it's pretty much self-explanatory like the warm-up phase. Cool down is just providing a smooth transition from exercise back to steady state activities like your normal daily activities. So again, the cool down is pretty much opposite of the warm up itself. So this workout portion can somewhat be overlooked and viewed as less important. However, it is important to do a cool down because it can help significantly impact the overall response to an exercise. So some of the benefits when it comes to a cool down is going to reduce your heart rate and breathing rate. So it's going to bring your heart and breathing rate back to normal, steady state. It's going to gradually cool down your body temperature. You're going to return your muscle to optimal resting lengths. It's going to prevent pooling of blood in the lower extremities, and it's going to restore your physiologic systems close to baseline. So it's just, bringing your body back to its normal daily life state is basically what the cool down phase is helping your body do. All right, so let's go ahead and go on past the warm-up, conditioning, cool-down phase, and let's talk about the progression you can do with cardio training. So basically, the progression itself, when it relates to cardio, is sort of goes back somewhat to what I talked about with weightlifting, where the best way to sort of gain muscle and to build on hypertrophy is to use progressive overload, which is gradually increasing your weight, gradually increasing the intensity of your exercise. And this can go the same way when it comes to the progression in cardio. So gradually progressing in both intensity and frequency and volume are all part of a systematic progression to create challenge. So 10% increase in volume, or greater than 10% increase in volume per week, is recommended and safe progression to start out. The rate of progression should all be based on your particular goals. So basically, what I'm talking about with progression is sort of, when you're starting to do cardio exercise, you want to start at a slow, steady pace. And again, this is basically the same as it relates to weightlifting. With weightlifting, you're going to start with a slow, I guess you would say a slow tempo. And then you would start with using lighter weights. You're going to do a slow tempo and lighter weights when you start out. But as you're going forward and when your body's beginning to adapt to those changes, so when you're building muscle, you're going to be able to lift more. So you want to gradually challenge yourself and build upon that with the progressive overload. So this goes the same way with cardio progression. You want to just gradually increase your intensity and frequency of that specific cardio exercise. So if you're walking on the treadmill, for a certain duration of time, then maybe you want to, increase the intensity of that and go at a faster walking pace or a faster running pace if you're running. So it's basically just increasing that intensity gradually. When you come to a point where you're comfortable with that exercise, then it's time to sort of challenge yourself. That's the way I see it. If you get comfortable, then it's time to challenge yourself. It's time to go beyond what you normally do in that exercise and sort of add weight or add intensity, add frequency. So that's basically what I'm talking about as it relates to cardio progression. It's the same way when it comes to weightlifting. The progressive overload is the same sort of concept. Cardio frequency. So frequency refers to the number of training sessions in a given time period. So below are the guidelines as it relates to aerobic activity recommendations. So at least 5 days a week to 150 minutes per week at moderate intensity, at least 3 days a week, 75 minutes per week at vigorous intensity, and 3 to 5 days per week, combination of moderate and vigorous. So, depending on your frequency and depending on your intensity, should determine how many days a week that you do cardio, as well as your time period that you're doing cardio, your time frame. So the more days you're doing in a week, the lower the intensity should be. The less days you're doing in a week, the higher your intensity should be. So I'm sure if you guys are sort of understanding that. So if you're doing a combination of both moderate and vigorous, then you sort of want to balance out those days, depending on how many days you're doing vigorous, sort of cardio exercise versus moderate. So again, when you're doing more days a week, you want to do longer periods, but at a moderate intensity. When you're doing less days a week, you want to do a shorter period of time, like 75 minutes, but you want to do more vigorous cardio activities. So it's just that sort of balance as far as the frequency is concerned. And these are sort of just recommendations if you're sort of going to integrate cardio into your daily routine. So, types of cardio exercise. So these can vary. The intensity of these can vary as well. So what we have here is basically a list of some of the simple sort of cardio exercises you may know. So, of course, there's normal exercise that you can do outside, such as jogging, walking, running, anything of that sort. Swimming as well, bicycling. These are all, cardiovascular exercises that you can do outside of, a gym. So you can also, of course, do cardio exercise in the gym when doing elliptical, treadmill, stair stepper. So these are great options if you just would like to be in a more, whatever you're comfortable with, I guess you would say. I preferably like to use cardio equipment. Some people like to jog outside more. It just kind of depends on what you're comfortable with. The really good thing with cardio equipment is you can sort of gauge your intensity and you can gauge the frequency of your exercises, and you can sort of keep track of your metrics more when it comes to cardio equipment versus doing just daily activities. Of course, you could still track that if you had like a smartwatch or anything like that, but I think it's beneficial with cardio equipment because you can be able to see sort of how long the time frame you're doing your cardio exercise. Usually they have timers on the equipment, so it just kind of helps with cardio equipment. But again, if you like doing activities outside, jogging, walking, running, it would be beneficial if you had like a smartwatch or or pedometer to sort of gauge sort of your intensity and things of that nature. So, it kind of depends on what you're comfortable with, basically. But there's all kinds of different types of cardio exercise. There's other types of machines that you can do as far as cardio equipment besides what I've listed. But I just wanted to do a simplified list. So, posture and cardio training. I do talk about posture and sort of overactive and underactive muscles a lot, and posture distortions, things of that nature. So I do want to discuss a little bit what posture and cardio, what the benefits can be, or what you can, if you're not doing active cardio, what can be the negative effects when you're doing cardio training. So some of the negative effects of posture distortions would be negatively affecting ventilation, oxygen delivery to muscle cells, low back pain, possible knee injury. Some common posture distortions related to cardio would be a forward head and rounded shoulders, anterior pelvic tilt, and adducted and internally rotated knees and pronated feet. So you want to be aware of your posture when it comes to cardio, just to prevent energy. to prevent injury. So you want to sort of be aware of those distortions. This kind of goes back to when I talked about cardio progression. You want to start at slow intensity and be aware of your posture when you're doing cardio exercise. Again, when you are not aware of these, posture distortions, they can have negative effects. It's going to affect your ventilation. It's going to affect your oxygen delivery to your muscle cells, low back pain, possible knee injury. So it's important to keep sort of track of your posture when you're doing cardio training. Alrighty, so that's pretty much all I have for you guys today. I hope that you found some good information here and some valuable information. Cardio training is one of my favorite things to do. I don't do it as often as I used to because when it comes to cardio training, you kind of have to balance it with weightlifting. And it can kind of be counterproductive if you're wanting to build muscle, you have to sort of lower your duration that you're doing cardio because you're burning too much to be able to, give the muscles sort of that nourishment they need from the food that you eat as far as protein. You don't want to burn that off. You want to be able to sort of use that protein and energy to help with building muscles doing weightlifting, if that makes sense. So you just kind of have to balance your cardio. You can do cardio even while you're doing weightlifting. You just have to do it in a smaller duration than what you would normally do. I mean, if you're looking to do fat loss, then cardio can be, a longer duration. It just kind of depends on your goals. Whatever your goals are is going to determine how often you do cardio, what your intensity would be, what your duration, your frequency of that cardio would be. So that's basically all I have for you guys today. Again, I hope you found this information valuable. I will do another live stream. I've already got it set. I haven't posted the event yet, but I am going to be doing it over plyometric training, which is sort of somewhat of an extension of cardio, but is slightly different. It's more focused on a structured exercise versus cardio is not as structured. So I'm going to be talking about plyometric training next Wednesday at 3 p.m. again. I will post the event page like I normally do, likely either today or tomorrow. If you guys have any questions about today's live stream, then you can send me an email, send me a message. You can direct message me through Facebook. Whatever you're comfortable with, I'd be willing to answer your questions or your concerns, your feedback. If you have any questions about a previous live stream, I'm willing to answer those questions as well. So thank you guys for watching this, and I look forward to seeing you guys next week in the next live stream.